Definitely my best experience during my time in EWMA has been the successful work in the EU lobbying. And the reason why that's really important, I think, is because if we can get the EU to say that wounds were important, that was the first thing we did. We didn't ask for any more money, ask for anything, just say, could you just say that wounds are important and that therefore they require a good intervention. And so we had great success with the MEP Rossi when we presented at the patient safety workshop, and then after that he included pressure ulcers and the importance of the multidisciplinary team in his own initiative, as he calls it, on patient safety. And that has been a leverage, something we use all the time when we're trying to say, look for funding for research, look for funding to influence clinical practice, look for funding for education, to say, look, wounds are important, the EU agrees with that, and that's important for us. In terms of how my involvement in EWMA has influenced my professional career, I think that particularly during my presidency, I learned unbelievable skills in terms of people management, in terms of how to manage meetings, negotiation skills, conflict management. So as a result of those skills and the opportunities that were afforded me here during my time in EWMA, I feel that they have definitely contributed to my leadership skills, and as a result of that I'm in a leadership role within the Royal College of Surgeons in Ireland. In terms of EWMA's role in wound management today, there's been some really key important factors that EWMA is definitely contributing to. First of all, in terms of the EU lobbying and getting the message out there that wounds are important and that patients are the centre of that, and as such require good interventions in order to be able to reduce the burden of wound care. Another important thing is the fact that EWMA works so closely with other organisations means that instead of a lot of different activities being taking place randomly, now the activities are collective, and having a collective voice really gives much more weight to what they're doing. In terms of documents, they're very, very valuable, and some of the work that, like for example, managing wounds as a team, really synthesise the evidence around teamwork and wound care, and as such can be a really valuable resource for somebody in practice who may well say, okay, look, I'd like to do this, what's the evidence to support that? So I suppose it's its role in education, evidence, working together, patient at the centre, and wounds are important. I mean, it really has been a successful 25 years for EWMA, but I think one thing I really would like to see is much more of the voice of EWMA within the clinical practice field. Not necessarily by all of us who have been working with EWMA and who know EWMA so well, but people within the clinical practice setting, kind of like when we would have more guidelines and how to implement the guidelines and how to affect change, that EWMA would be the voice, that they would be saying, oh well, I learned that at EWMA, and I looked up EWMA and this, I found the guidance there. I think that would be really, really important, because that means that I think EWMA would have come the full circle then, because it's grown and developed so much, so many people are involved in it. Now we want to make sure that there's absolute evidence that that involvement is impacting positively on patient care.